my name is Jessica Morales and this is my musculoskeletal assessment. At this point I would have already washed my hands and gloved up. Alright, we'll start off by introducing myself. My name is Jessica and I'll be your nurse. I'm going to do a musculoskeletal assessment. Can I get your name and birthday?
Hi, my name is Luis. My birthday is May 17, 1990.
Okay, awesome. So before we start, the musculoskeletal assessment is gonna, I'm gonna be checking joint by joint. I'm gonna be doing passive and active range of motion. I'm gonna have you like stand up and walk a little bit. So at any point, if you feel any discomfort, just let me know, okay? All right, so first off, a little bit of history. Have you been experiencing or have you had any muscle pain, any bone pain, joint pain, any weakness?
No, I wouldn't have any
No.
of those pains.
Okay. And have you ever had like a sports injury, a sprain, a strain?
No, I don't play sports, so I don't have any injuries.
Okay. And any history of arthritis, osteoporosis, nothing like that?
No history of arthritis.
No? Okay. All right. Perfect. So we're gonna first, I'm gonna be doing an inspection. That's the first part, and pretty much that's just looking at you generally. Overall, I see no obvious deformities, like your shoulders are not off, you know, your legs are not off, so you look pretty symmetrical to me. And then, so everything looks good there, and then overall, I don't see like any, your muscles seem about the same, but we'll inspect the muscle mass as we go too, okay? We'll start off by passive range of motion, which is I will be doing most of the work. I will be doing the work, and I will be at the same time palpating and feeling for any, what we call crepitus, so like any grinding, and that sometimes happens with like overuse. So I'm feeling for any deformities, any swelling, any, warmth. Also, I want to make sure that I'm going to be assessing your skin color and the muscle around it to check for any atrophy or anything like that, okay? All right, so we're going to start off with the shoulder. I'm going to palpate here around this articulation, this joint of your shoulder. Okay, so I don't feel anything, and then I'm going to grab this arm here, and I'm going to just like lift it up and down. Would you do me a favor and sit up a little bit? This chair has these, sit more front. There we go, perfect. Okay, so I'm feeling here, and then I'm going to move the arm. You can just relax your arm. I'll be moving it here. Okay, perfect. So I don't feel any crepitus. I don't feel no grinding. I don't feel like any abnormalities. And do you have any pain when I do that?
No pain.
Okay, so I'm going to go down to your elbow. I'm going to feel back here the articulation of the joint. I don't feel any abnormalities, and you don't feel any pain.
No pain.
And I'm going to go ahead and move it up and down and maybe outward like this, and there's no discomfort?
No discomfort.
No? Okay, good. Okay, I'm gonna go down here to the wrist. I'm just feeling the wrist overall, and you let me know again if you have any discomfort. I'm gonna move it this way here. Okay, I'm also gonna just be assessing your hand here, and I'm gonna go joint by joint on your fingers, and just again tell me if you have any pain. Sometimes in arthritis, we feel some swelling, or your joints are inflamed, but everything seems pretty normal here. Okay, looks good. All right, we're gonna go down to your lower extremity, and can you uncross your legs for me? All right, so this chair kinda is not the greatest here for this assessment, but we'll try our best here. So I'm gonna feel for the hip, and you can sit up. All right, so I'm gonna put my hand here at your hip joint, and then I'm gonna kind of lift up your leg and then move it outward, and then in. Do you have any discomfort when I do that?
No discomfort.
No? Okay, good. And I didn't feel any abnormalities. And we're gonna go down here to the knee. Sorry if you can't see all that great there, but I'm gonna go ahead and hold on to his knee here. And this is the most common area where we have injury, because this is the articulation where the femur, the tibia, the fibula, all come together in the patella. So I'm gonna, just check to see again for any abnormalities or any crepitus or anything like that. And then I'm gonna move your leg up and down, and I don't hear any popping. I don't hear nothing. Any discomfort when I do that? No?
No problem.
Okay, good. Let's see if I can move the camera a little more down. Let's see if I can just do this here like that. Okay, that might work. All right. I'm gonna go ahead and just feel your ankle now. Do you want to move that a little bit? No, sorry. No, this moves the chair back. There we go. Okay. So, feeling the ankle and the back of the ankle, holding the joint, and I'm just gonna move the ankle up and down and laterally, inward and outward. And I don't feel anything. And you're okay. You don't have any discomfort. And I'm gonna go ahead and go down on the foot and. All right, no feeling that you're at all of your toes, and you have no pain, right? Okay. All right, so that looks good. I'm gonna go ahead and do this side now. Gonna wash up my hands, touch your feet. All right, feeling, palpating, or again, the same thing, crepitus, pain, swelling, warmth, anything like that. All right, and I'm gonna hold up your hand and I'm gonna just move it. You can just relax your arm. There we go. Up. Down. All right. No pain, nothing. I don't feel nothing. Elbow. You can move it up, down, this way. I don't feel anything. Everything seems normal. Now at the wrist. Bringing it up and down, feeling for it. All right. At the fingers, each finger feels fine. All right, and at the hip here, I'm gonna go down here and feel for your hip, and now lift up your leg. You can just bend your knee real quick. Lift up your leg and outward and inward. No pain?
No pain.
Okay, and now with the patella again, that knee area, the patella, the femur, all of that coming together, this articulation, moving it up and down. Feels okay?
Feels good.
All right, and then again at the ankle, moving it up and down, and moving it side to side, and your toes here all feel fine. Yep, everything looks good. It's normal there. Okay, so I'm gonna ask you to stand up, and I'm just gonna have you walk a few steps, maybe like 2 steps there. And I see your posture overall is good. I see your gait is steady. You walk fine. All right, and then can you turn around for me? I'm gonna go ahead and check your axillaris, your spine. So first of all, we're just checking to see if all of your, your vertebrae stack up. Your spine feels good, and there's no cracking, there's no deformities. It feels pretty aligned. Any back pain? No? And now, can you just bend for me? Try to bend at your hips. And again, I'm checking the same thing, checking to see everything is nicely stacked up, and it looks good, and there's no obvious curvatures, no signs of like scoliosis. Everything looks pretty good there. Okay, can you turn towards me now? All right, so now we're gonna do a few active range of motion. So this is gonna require you to do most of the work, okay? All right, so first off, we're gonna check the range of motion of your neck. So if you could put your chin to your chest, now chin upward to the sky, to the right. No, I'm sorry. Go ahead and look to your right, then look to your left, and then laterally bend like ear to your shoulder, and then the other way. And no pain?
No pain.
That's good. Okay, good. All right, so next we'll do the shoulders. And the shoulders, you're gonna lift up your shoulders. You're gonna bring them down. You're gonna hug yourself. And then you're gonna take one arm at a time. You're gonna bring it to your back, like if you need to scratch your back. Okay, and then the other one. So bring the other one in now. There we go. Okay, so good. So pretty much right there, if you were to have like a rotator cuff or any problems with your, your shoulders, you wouldn't be able to lift up your arms very much. It would be very limited. So that looks good. Okay, and then the elbows are pretty easy. You're just gonna extend and flex. That's good. And while you're doing that, I also want to check your strength. So I want you to push towards me. I'm gonna push towards you, and I want you to have some resistance there. Okay, good. And now the other way around, you're gonna pull towards you. Very good. Okay. Strength is good. Okay. So we're gonna go ahead and do your wrists. And the wrists, you're gonna do a few things. You're gonna first, we're gonna go supine, so up, and then pronation down, and then you're gonna go ahead and close your fists. I'm sorry. First, go ahead and go up, and then down. Close your fists, open them, bring them together, and then deviate them out and in. Good. No pain. Feels good.
Okay.
All right, good. All right, so next, let's just go ahead and check your back. So for the back, you want to extend you want to kind of bring your back, there you go. And then go ahead and bring it to the right first, like this. There you go. And then to the left, and then rotate. And then that feel good? Mm-hmm. All right. Okay, so then we're going to do your hip. Your hip can do so many things, but we're going to go ahead and check extended and flexion. So for the flexion, you're gonna just bring your leg up and then extend it out like if you're doing a lunge. So just bring it outwards. Yeah. Let me bring this a little bit this way, like that. Okay. Yeah. So again, up and then extend it out. Good. So same thing with the other one. Extend up and then out. Okay. Good. You could just touch the floor like that. Okay, all right, so for the knee part, we're gonna go ahead and bring your leg up and then just literally try to like move it up and down. There you go, perfect. Same thing with the other side. Same thing with the other side, just like that. There you go, at the knee, just at the knee, bend, good. All right, and so for your ankles, I'm sorry, actually, let's go back to the hip. I wanna check one more thing for the hip. So for the hip again, bring it up, bring it back, bring it forward, and then cross them, and then out. Good, really good. Okay, other side. So up, back, then to the front of you, cross it, and then outward. Okay, perfect, thank you. All right, so then we'll do your ankle. Your ankle, you're just gonna bring your ankle up, down, and rotate it. Okay, good. Other side, up, down, and rotate it. All right, it's kind of hard for me doing it with you too. And then lastly, your feet, just your toes, just bring them out, try to separate them, and then just bring them back in. Like, yeah, there you go, perfect. Other side. Okay, great. All right, so if you want to sit down for me, I'm just gonna check the strength of your bottom. There we go. All right, okay, so we already checked your muscle strength on your arm, on your upper extremities, so just your lower extremities. I'm just gonna have you, I'm gonna put pressure on your shins here, so you just try to extend your legs. Good. Oh, you're way stronger than me. And then now try to bring them back in. There you go. Okay, good. And now for your pedal pushes, go ahead and lift up your, okay, now press down on my hands. Good. And then press up. And just with your feet here. There you go, perfect. Okay, really good, very strong there. Okay, so everything seemed pretty normal. You didn't have any discomfort, any pain. I didn't notice any deformities. Everything seemed pretty good. Do you have any other questions?
No.
No? All right, thank you.